As I mentioned in the lecture video on blood, blood donation is a really complicated thought process. So here's the video for that. The American Red Cross is primarily responsible for collecting blood donations across the country. That's their primary focus. And while you can donate directly to a hospital and to a clinic and things like that, the Red Cross is the primary organization in charge of that. So some of you perhaps have donated blood before, and your motivation might have been anything from pizza party afterwards to the cheap little free t-shirt to, for me in high school, it was I didn't have to run in gym class that day because I donated blood, so that worked out all right. So whatever the case is, you may have donated blood. And some of you perhaps just wanted to be a good person and help other people and save lives. One of the advertising gimmicks that the Red Cross uses is the idea that 1 pint of blood can save up to 9 lives. And so that then convinces you that your donation of blood saved 9 people's lives. And that's complete garbage. If a person actually is about to die because of lack of blood, they're going to need more than 1 pint at a time. So 1/9 of a pint is not going to save anyone's life. And when it comes down to it, you can be very, very anemic and short on blood. And the criteria for getting a blood transfusion is just about that you're going to die without it. So again, if you're just a little low, you don't get a transfusion. So a person needing a transfusion might need 2, 3, 4 units, not 1/9 of a unit. It's a fabulous marketing technique, but it's completely inaccurate. So here on their website, what we're going to do is look at exactly what the Red Cross says in terms of criteria to donate. This is sort of the biggest piece of the puzzle, is who can donate blood, under what conditions can they donate blood, and what does that then mean about the safety of that blood to be given to someone else. So here on the website, the first thing on the list is to donate. And if you want to give money, they'll always take that. Or they'll take a stock transfer. Or they'll take your estate if you want to leave them your house and everything when you die. Here in the Give Blood section, let's just look at eligibility requirements. And every time I'm on their website, they've changed something, so we may have to stumble our way through this a little bit. Here we have requirements by donation type. And whole blood donation is probably the one that most people do. And the limits there are you can only do it every 56 days. No more often than that. And that's because your body needs a chance to replace those blood cells that were lost in the donation. And if you donate more often than that, you'll short your body. You must be in good health and feeling well, with a double star there. We'll go down and look at what the stars mean in a minute. In most states, you have to be at least 16 years old. The numbers on that will vary state to state. And you must weigh at least 110 pounds. The idea there is that you need to be big enough and have enough blood that you can spare a pint. The second option for donation is a power red donation. And this is basically where they're taking pure red blood cells and putting the plasma back in. So this is a more useful kind of donation, because they're getting a unit of pure red blood cells that is much more useful per se. But you can only do this every 112 days up to 3 times a year, because again, they're taking even more concentrated red blood cells out, and it takes longer to recover that. Again, you must be in good health and feeling well. Male donors have to be at least 17 years old, be at least 5 foot 1 inches tall, and weigh at least 130 pounds. And females need to be 19, 5'5", 150 pounds. Again, the idea there is they want to make sure they don't take too much blood out of someone who doesn't have enough to spare it. Platelet donation can be done about once a week, up to 24 times per year, so really every other week is what it would average out to. And there they're going to take platelets and help give to people who have platelet deficiencies that would help them with blood clotting. If you happen to be AB type blood, Remember, that's the rarest blood type of the 4 among all different ethnicities. You are considered an elite, and they can do an AB elite plasma donation about once a month. If you have type AB blood, you're 17, you're in good health, you weigh 110 pounds or more. And so the plasma in that case is less common and therefore worth more on the resale market. Now, I say the resale market. You donated your blood to the Red Cross, but they did not donate your blood to the people who needed it. They sold it. So calling themselves a not-for-profit charity is a little bit misleading because they are actively involved in selling donations to people who desperately need it. So there's actually quite a bit of profit involved in the process. So those are just some general overall guidelines. Let's go back up here and look at some more specifics. And again, they've moved the location of this, so we're going to have to bop around until we find it. There's a whole section over here on coronavirus and blood donation and plasma donation. Ought to be good for a few minutes of interesting reading if you're interested in doing that. But what I want to talk about... Oh, we forgot to look at the stars and what the stars mean. And here's where I was looking for there. So let's go down to the bottom here and look at the stars, the disclaimers, and the single star is just talking about how often you can donate based on different types of donations. The double star we were seeing over and over, along with the healthy and feeling good designation. So here that means, healthy means that you feel well and can perform normal activities. If you have a chronic condition, such as diabetes as an example, that means you're also being treated for diabetes. Your diabetes is currently under control, and again, you feel good that day. And interestingly enough, this also applies to herpes. If you have herpes, as long as you feel good today, then you can still donate. And we'll look at that a little bit later in more detail when we get to STDs and how that affects donations. So let's look at illness deferrals. So why you might not be allowed to donate, or what the criteria would be in those cases. So general health considerations here. Cold and flu. If you have a cough that's actually coughing up mucus, then wait. If you don't feel good that day, wait. If you're on antibiotics, wait until you finish. Weight and height, again, you have to be big enough to spare the blood. Allergy, stuffy nose, itchy eyes, dry cough. As long as you don't have a fever and you can breathe, you're fine there. Donation intervals, we've already talked about those specifically. So let's go back up here to medications and vaccinations. So how might vaccines and medications you might be on affect that? Aspirin is no biggie there for whole blood. If you're donating platelets, you need to wait a couple of days so your blood's thick enough to actually have enough platelets to be able to get any out. Antibiotics. If you're currently taking antibiotics, then you shouldn't be donating blood. If you've just finished your antibiotics, then it depends whether it's an injection or a pill. Birth control, not a problem. What's interesting is if a male receives blood donation from a female, she's on birth control, and he then gets a shot of estrogen. Or a female who receives a blood transfusion will experience temporary and perhaps minimal birth control effects. Probably if you're getting a blood transfusion, you shouldn't be becoming pregnant or trying to get pregnant at that point, so it's probably not a big deal there. Immunizations. If you've vaccinated for most of the different things that you get vaccines for, you're fine. A couple of them, let's say here, German measles, MMR, chickenpox, that sort of thing. Wait 4 weeks after that because some of those are live viruses and you wouldn't want to give a very, very sick person a disease by a blood transfusion. HIV used to be transmitted this way until they discovered it, and hopefully we stopped that. Smallpox vaccination, as long as you didn't develop smallpox symptoms after the process, 2 months is fine there. If you had symptoms of smallpox after the vaccine, you need to wait a couple of weeks after that clears up. If you take insulin, since 1980, if you've used cow insulin, so insulin coming from a cow, that was from the United Kingdom, so Great Britain, England. If you had a shot of insulin from a cow from Great Britain after 1980, you cannot donate blood to anyone because you might have mad cow disease. Medications in general are not a problem. There's a couple of things on the list here that you need to wait a couple of days, perhaps a couple of weeks for, but for the most part, medications are not going to be a big problem. Every time there's a possibility of being ineligible to give blood, they'll always give you an opportunity to make a financial donation. So you'll find that particular link scattered throughout the Red Cross's website in hundreds of different locations. If we look at travel outside the U.S. and immigration, what that might do to your blood donation status, the first question there is, where did you go? So malaria is a significant concern with the idea of traveling. So if you go anywhere outside the United States and Canada, they'll ask you some more questions. So if in the past 3 years you've been outside the U.S. or Canada, the questions are, what countries did you visit? Certain countries have different endemic health problems that you need to be aware of. Where did you travel while you were in the country? Did you leave the city or resort at any time? And if yes, where did you go? So apparently, diseases don't cross resort lines or city lines. So as long as you stay inside the city and inside the resort, apparently you're safe. But if you stepped across the resort property line, now you're in trouble. For those of you who perhaps don't know me very well, that was a bit of sarcasm right there. What mode of transportation did you use? Again, apparently maybe a taxi's okay, but if you walked, now you're at risk, or who knows what they're thinking there. How long did you stay there? That is actually relevant. The longer you're in a particular country, the more exposed you are to things. And then when did you return? And they're especially concerned about malaria because there is no test for malaria. So your blood is not tested for malaria before it's given to the next person. Interestingly enough, though, they could simply look at a drop of your blood under the microscope and diagnose you as malaria positive or negative if they cared to, but apparently that's not important. If you've had malaria, they want you to wait 3 years. If you've gone to a place where malaria is found, wait 12 months. Wait 3 years after living more than 5 years in a country where malaria is found. Wait an additional 3 years if you've gone to an area where malaria is found and have not lived in 3 years or more in a country where malaria is not found. So if you haven't lived in a malaria-free country for 3 or more years in a row, then wait an additional 3 years. So we might be waiting up to 6 years for some of these situations here. If you spent long periods of time in a country where mad cow disease is a problem, then you might have the human version of mad cow, the Creutzfeldt-Jakob disease. So that takes you off the list forever. Now what we're seeing here is that it used to be if you ever went to Africa or malaria-prone places, then you were just off the blood donation list forever. But what they're doing is they're going back and they're reducing the restrictions and requirements, making it less and less restrictive about who can and can't donate blood. And I personally consider a lot of those moves concerning because you're increasing the risks of that donated blood having some particular problem. And as you've seen here for malaria, they don't test for that. So for all they know, they took malaria-positive blood and gave it to somebody else, in basically medically inducing the next person with a case of malaria. The other things in terms of AIDS and things like that, yes, they test for those things before they give the blood to someone else, but tests are not perfect. So the more risk you have in the blood donation pool, the more risk you have in a person who is going to receive that blood. So I personally am not in favor of reducing these requirements at all. But I think in the name of trying to get more blood in the blood pool and not exclude people, so we don't want to discriminate against someone because they're a high risk for disease individual, we'll take your blood anyway and hope that the test catches it. If you have a Zika virus, wait 120 days after you don't feel like you have Zika virus anymore. Ebola, if you've ever had Ebola, then you shouldn't donate blood, ever. Medical conditions that affect eligibility. Allergies, as long as you don't have a fever and you can breathe, you're fine. Asthma, as long as you can breathe, you're fine. A bleeding condition. Well, what is it and why is it? If you have something like hemophilia, you shouldn't donate blood because the needle puncture will cause you to bleed excessively. If you're on blood thinners, you probably shouldn't donate blood because it's going to make your blood too thin and not clot. It's okay, again, for aspirin. I believe we looked at that earlier. Blood pressure. If you have high blood pressure, if it's really, really high, so as long as your blood pressure is under 180 over 100, you're okay to donate. If your blood pressure is over that, you need to be in a hospital, not at a blood donation site. Low blood pressure, you need to have a minimum blood pressure of 90 over 50, basically to make sure that if we take out more blood, it doesn't drop your blood pressure too low. But interestingly enough, if you have really high blood pressure, removing blood from the body actually is a way to somewhat drop blood pressure. So maybe if your blood pressure is over 180 over 100, maybe you do need to donate blood and get some of it out of there. Let the hospital do that, though, not the Red Cross technician. If your pulse is within a reasonable range, then it is okay to donate blood. If you have cancer, as long as it's not a blood or bone cancer, and as long as they believe it has been treated successfully for more than 12 months, then you are fine for that. Chronic illnesses. Most chronic illnesses are okay as long as you feel good today. Creutzfeldt-Jacobson, mad cow disease. So if you have ever gotten a dura mater, that's a layer of brain covering tissue transplant, or human pituitary growth hormone injection, that might be a problem, so you're off the list. If you have mad cow disease, clearly you should be off the list there, but you can always volunteer, host a blood drive, or make a financial donation. Diabetes, as long as it's under control. Heart disease, as long as you don't currently have heart attack symptoms, and it's been a couple of months since the last heart attack or pain or heart surgery. If you have a pacemaker, as long as your pacemaker is doing its job and keeping your pulse at a normal rate, it's fine. Heart murmurs, heart valve problems, no problem. Hemochromatosis is not an acceptable condition to have and donate blood, so that would take you off the list. If you're anemic, then you will need to wait. If you have hepatitis, you shouldn't donate blood. That will definitely give somebody else hepatitis. Hepatitis exposure. Wait 12 months after the last contact. with someone sexually who has hepatitis. If you've been in a juvenile detention, lockup, jail, or prison for more than 72 consecutive hours, wait 12 months. If you're there for less than 72 hours, so if you're released at 70 hours, apparently you're okay. That extra hour or two to the 72 hours and 1 minute becomes a real problem. Interestingly enough, things like weekend incarceration, where you might spend several weeks a year in jail, it's okay because it wasn't more than 3 days at a time. If you get stuck with a needle or get a blood transfusion, wait 12 months because who knows what you theoretically could have picked up there. HIV/AIDS, obviously don't donate blood if you're at risk, which means if you've used needles to inject illegal drugs, if you have engaged in MSM sex, so that's a male having sex with another male in the last 12 months. It used to be called homosexual, now it's labeled MSM. So if you've had MSM in the last 12 months, then you need to wait for another 12 months and make sure that everything appears to be okay there. We'll get to in a little bit later some very interesting stuff, but gender is self-identified and self-reported. So your biological gender doesn't matter in this case. The only thing apparently that matters is the gender that you identify as. So MSM is not okay, but interestingly enough, if you are a biological male who currently identifies as female, and you have sex with a male who both gender and identifies as male, then it's not MSM because you called yourself an F, not an M. So it's FSM, and that's okay, even though biologically both partners were male. That is still a high-risk behavior, no matter what label or gender identity you take on today. So this is, by definition, introducing risk in the gene pool, or not the gene pool, sorry, the blood donation pool, because you have the high-risk behavior that just doesn't happen to be labeled as this criterion for high-risk behavior, but it still is. If you've ever prostituted yourself for money or for drugs or for anything else for that matter, then that takes you off the list. If you've had sex in the last 12 months with anybody who did those things we just talked about, wait another 12 months. High blood pressure, we talked about that. Infections, as long as it's resolved, you finished your meds. Unless it's Chagas, babesiosis, or leishmaniasis, you're good there. We've covered the malaria thing already. Sickle cell. If you have sickle cell trait, so if you're heterozygous, you're okay to donate. If you have full-blown sickle cell disease, so you're homozygous, then not eligible to donate because a lot of your red blood cells are sickled. A skin disease is okay as long as the place where the needle's going to be stuck in doesn't have an outbreak of that disease at that spot. Tuberculosis, if you're being treated for tuberculosis or have active tuberculosis, then you shouldn't donate blood. Otherwise, you're fine. Measles. As long as your vaccine was more than a month ago, or your exposure to measles was more than a month ago, you're fine there. Medical treatments. Acupuncture is okay. Blood transfusion, wait 12 months. If you got a blood transfusion after 1980 in the United Kingdom or France, then you might have mad cow, so that takes you off the list. Dental procedures and oral surgery, as long as you didn't get an infection afterwards. Hormone replacement therapy, no problem. Organ and tissue transplants, wait 12 months. If you get a transplant of animal organs or animal tissue, then, and we should say living tissue, then it is not okay to donate. Heart valves are okay because they are considered non-living tissue. That's not really accurate, but okay. Surgery. What was the surgery for? And then you'll talk about what the surgery was for, and they'll make a decision on the spot. Let's leave the lifestyle and life events just for the last here. Lose sexually transmitted diseases. Wait 12 months after you've been treated for syphilis or gonorrhea. Chlamydia, venereal warts, that's human papillomavirus, otherwise known as genital warts, or genital herpes are not a cause for deferral if you feel good today. You heard me. Chlamydia, genital warts, genital herpes. If you feel good today, donate today. Even with an active infection. That concerns me slightly. We talked about HIV/AIDS already. Venereal diseases, that was the syphilis, the gonorrhea, the stuff we just talked about there. We just talked about that. So, again, wait 12 months after syphilis, gonorrhea. For the most part, the rest of them, if you're feeling good today, off you go. Donate away. Now, here's where it gets a little bit complicated. Age, as long as you're of legal age. Let's come back to the MSM in a minute. Intravenous drug use. So shooting up illegal drugs, can't donate after that. If you're pregnant, you should not donate blood while you're pregnant. You need the blood for you and your baby, people. And wait 6 weeks after you give birth. I'm thinking you don't have the energy to walk into a blood donation clinic for longer than 6 weeks, so we should be all right there. If you get a tattoo and it was applied in a state that does not regulate tattoo facilities, wait 12 months after the tattoo to make sure you didn't get hepatitis from it. The states that do not regulate tattoo facilities: District of Columbia, Georgia, Idaho, Maryland, Massachusetts, New Hampshire, New York, Pennsylvania, Utah, and Wyoming. So if you get a tattoo in New York City, it was not perhaps a health department inspected facility, and so who knows what kind of crazy business is going on there. If it was applied in a health department regulated and inspected facility, assuming they use sterile needles and non-reused ink, then you can get a tattoo today and donate blood tomorrow. Piercings and electrolysis. As long as the piercing was performed with the single-use and disposable equipment, get it today, donate today. Wait 12 months if it was performed using a reusable instrument of any sort. If you're not sure, wait 12 months anyway. So let's go back up here to this donor deferral for MSM. And you're going to have to really listen and pay attention here because it's going to get really confusing really quickly. If you've engaged in MSM in the last 12 months, then you're off the list until you've had 12 months after that. Here's where it's really complicated. Because gender is self-identified and self-reported, which they say right here is relevant to the transgender community, then you get to tell them that day what gender you are, and you get to decide. So here's the thing. If you are biologically male, and you identify as male, you engage in intercourse with another individual who identifies as male regardless what their biological gender is, then you are deferred from donation. If you are, however, a male who identifies as female, have sex with anyone else who identifies as anything else, you are not deferred. If two females who are biologically female, who both identify as male, engage in sexual activities, then that is MSM and they are deferred for 12 months. even though biologically they were both female. So as long as the identified gender matches MSM, you're deferred. Any other identity combination does not defer donation. And here's the problem. Identity has nothing to do with risk. So what you identify as today has nothing to do with what your risk factors are for having a particular disease. What your biological gender is and what kinds of behaviors you engage in directly impact risk. So really what this is an accommodation for the LGBTQ plus community in which they can basically identify as what they choose to identify as, and biological gender no longer is relevant, apparently. Now, interestingly enough, on those forms, they only have male and female boxes. So if you identify as other, they say, well, okay, that's fine, but you have to pick one of these two, so pick it. And so that gets into some confusing waters there. Let's look at this little statement here on LGBTQ plus donors. It gets into even more complications here. They say that their top priority is the safety of the donors and the patients who get the blood. Yet again, they're reducing the stringency of their criteria, which is somewhat contradictory. So, blood donor eligibility, we've already talked about the have to be this size and all that good stuff. Health history screening, they're going to ask questions to try to assess your risk factors and if you've done any of those things that take you off the list or not. And here it says that the idea of sex is any sexual activities. Vaginal, oral, anal, regardless of whether or not a condom was used. So they don't really care what kind of sex it was, and they really don't care what kind of protection was used or wasn't used. And last I checked, biologically, both of those were very relevant. Vaginal intercourse is a much lower risk intercourse than is anal intercourse, and that has to do with the likelihood of transmission of diseases, especially HIV. Use of a condom or not use of a condom, very relevant, because if you use a condom, there's much less likelihood of disease transmission. So in my opinion, both of those concepts very relevant, but they are choosing to say they don't care, it doesn't matter, we don't even want to know. The MSM thing, we've been talking about that here. And if you've been deferred in the past, some people had a lifetime deferral. So it used to be that you were at risk for getting HIV with sexual behavior, with drug use, that sort of thing. You were off the donation list forever. Now you can go back and you can petition to be put back on the donation list again, as long as you follow the last 12 months. No MSM, you're fine. WSW is okay because, again, that's not MSM. But if it's biological WSW but identified as MSM, not okay there. So, again, that confusing contradiction there. Again, for transgender, self-identify, self-report, but there's only a male and a female box. So pick one. And that's what it is for the purposes that day. Intersex donors, and here's where you're going to have to Google these terms and find out exactly what they mean. And a lot of them sort of overlap with each other. But again, it's self-identify, self-report, but you have to pick one of those only two options. Gender nonconforming, gender queer, gender fluid, agender, or non-binary. Again, you'll have to Google all those terms independently. Same kind of concept, self-identify, self-report, but pick one of the two options. Asexual donor, if you choose to remain abstinent and not engage in sex with other people, then you're eligible to donate blood. What about that? These are some specific questions that really go back to what we've been talking about all along. So here's one of those specifically: a trans man, so biologically male, or no, sorry, biological female. They don't call it biological gender, they call it assigned sex, but that's the same thing as biological gender. So biologically female, identifying as male, has sex with another man, and that counts as MSM. Even though, again, one was biologically female. Trans woman, okay, so was born, so biological gender male, identifies as female, has sex with a man. You can donate because that's not MSM. It's a question, don't you test all the blood anyway, so what does it matter? It says, yes, we do, but it's not 100% effective. So the testing really isn't all that wonderful, and we've got all this risk here. So obviously you can feel how you want to feel about these policies, but I do believe that biologically these policies of reducing the eligibility requirements across the board and allowing individuals who engage in high-risk behaviors to continue to be part of the blood donation pool increases the risk of all donated blood in the system. And the more risk there is in the blood pool, even if the test only fails to identify things, let's say 0.1% of the time, but you have a bigger blood pool to start with, 0.1% mistake rate becomes a much bigger number of units of blood. So I would propose that this does increase the risk of disease transmission via blood transfusion. Hopefully that was informative, and all the things I said there were right there on their website, so that's why we were here, so you could see that I wasn't just making this stuff up. And well, stuff you perhaps should know as you work with blood and blood transfusions in your possible future career as a healthcare provider. So hopefully this was informative and lots of learning opportunity for you. I'll see you next time.